It's important for a patient to communicate any medications that they're routinely taking prior to surgery to both your surgical team as well as your PAT team. These are vital for us to know ahead of time because some medications require you to hold just the morning of surgery, some will be the night before, and some of our medications are actually need to be held up to a week out before surgery. So it's really important for us to know what medications you're on so we can best direct you. One class of medication that's particularly important for us to know about ahead of time are weight loss or diabetic medications such as Ozempic or other GLPs.
Those we typically ask patients to stop a week before their surgery date. Some other things would be like blood thinners, which depends on the type of blood thinner you're on. Those get held typically anywhere from 3 days up to a whole week prior to surgery. And we're always in communication with both the surgeon's office and the physician or practitioner that's prescribing those medications to make sure it's safe to hold those for that amount of time.
NPO means nothing by mouth. It is extremely important prior to surgery. The reason being is that if you ingest food, drinks before surgery, when you have general anesthesia, what it does is it causes your entire body to relax. That includes your stomach. And if your stomach relaxes and there's food in it, then you can aspirate, which means that you regurgitate out of your stomach into your lungs, and then you end up potentially with an aspiration pneumonia, which can make you very, very sick and require longer hospitalization.
So I always tell my patients with the potential side effects of anesthesia like confusion, dizziness, brain fog, they always need to have a responsible adult to take them home after surgery. This is most commonly a friend, family member. Sometimes Geisinger or other organizations nearby can help arrange rides as well, but it's really, really important for patient safety. We don't want you driving immediately after anesthesia. We want somebody to make sure you can get home safely.
It's important that you communicate with your surgeon in the days leading up to surgery if you're feeling ill. There are certain types of illnesses that do not increase the risk of anesthesia or surgery, such as head colds. Frequently, we can proceed without any problems in those circumstances. However, febrile illnesses or chest congestion, or if you're bringing up mucus, these are things that will frequently lead to delay or cancellation of surgery due to some increased risks of anesthesia. So if you're having these types of symptoms days leading up to surgery, it's important to communicate that with your surgeon, and they can work through whether or not you should show up to surgery that day or if they should just plan on postponing it. If you wake up the morning of surgery and you're having these types of symptoms, you could do one of two things. You could call the hospital and get in touch with one of the anesthesia team to go over your symptoms, or you could come in the morning and be evaluated that day.